I decided to make another video basically stating the symptoms and of my hernia. So the one that's really a pain in the butt is probably from bloating. I can't eat a lot. Oh, she's fat, she needs to eat a lot. No, I'm actually dieting. Screw you. And I'm doing good, okay? I used to be 376. Now I'm 320 something. Anyway. I don't know if I can... Can I, I don't think I can. Oh, I just took a picture of myself. I wanted to turn it around. And show you my belly. Because there's a bump there. It doesn't look like there's a bump there, but there's a bump there. And then on top of that, my stomach looks bloated. That's because it is. But anyway, I think because of that, I looked it up. I've been looking up a lot of stuff about hernias and constipation, but I'll get to that later. But yeah, like, I can't eat much. Basically, what I, like right now, I can, they're very thinly sliced. Like, I'm eating this. It's turkey that you put on sandwiches. I'm just eating it by itself. I can't exactly eat a lot of that. And it's thinly sliced. And I had one little thing of watermelon. Oh, I'll show you. Very small watermelon. My stomach did not like that. It felt full. Very small watermelon, mind you. And my stomach doesn't like me eating much. And then every single day, either my stomach hurts from being so hungry. It used to be a lot worse. I did push my hernia in, but it popped out again. It's not as present as it was, but I'm still having symptoms, and I made everything worse. Anyway. And when I popped it in, I felt something go back in, and it was the most disgusting feeling. Of course, the hole was that big. Probably bigger like that, yeah. So, stuff still popped out. So I'm screwed. That's why I'm having surgery next week. But yeah, I can't eat much, and it's driving me insane. Now I'm going to talk about something else. Constipation. I've been constipated for 2 whole weeks. I've been having, and I've just, a couple days ago, well, 4 or 5 days ago, my grandparents, my amazing grandparents, give me Miralax. It works, but I'm going to warn you, if you take too much, your stomach will hurt. And I mean hurt. And it'll make you really nauseous. Like, not only if you take too much, you'll become nauseous. Your poops will be diarrhea. Nothing but. And diarrhea, it will dehydrate you. So that's not good. But I have had some progress because the past 2 days I have took less. So less diarrhea. And I had some solid poops today. I know you don't want to know this, but I'm going to tell you anyway. I had some solid poops. So that was good. I kind of had to force it. I really shouldn't force it considering I have a hernia. But I do anyway. I just want to poop. I just want to do a simple thing and poop. I just want to poop. This constipation is also kicking my butt. I hate it with a passion. But the Miralax is doing wonders, and I'm pooping, so that's good. And I'm peeing a lot. A lot more than I used to. And I was tested a couple times with urine samples. My bladders and urine is fantastic. I think it's the hernia, because the hernia is pressing up on lots of the organs. Oh, and I had period problems. You don't want to know this too late. So, I had a period for 9 to 10 weeks. Not normal. Hopefully I'll get a UDI, which I heard is extremely painful. But the first thing they're going to do is take a snippet of my uterus. They're going to give you Mia volume, but beforehand I go to that appointment, I'm taking 4 ibuprofen. That's like 800 milligrams. Anyway. I forgot what I was talking about. Oh, poop. Oh, yeah, bladder stuff. Oh, yeah. So I talked to the nurse, because I did, this week, I think it was on Wednesday? I can't remember the day. But I talked to her about it, and I told her I was off my period for 2 weeks, because it stopped, thank God. And I told her I was having uterus pain, and she's like, yeah, that's probably the hernia. The hernia's affecting so much. I'm so tired. I just want it to end. And let's not forget the electric pain, which is nerve pain, by the way. There was this one time I got electric pain. It was beside the hernia, and it just shot up to my breast. And then there was another time where I had that pain, but it shot down my leg. And then after that, twice, it shot down to my kneecap. One day after the other. And I'm still having pain every single day. And the pain has gotten, there's more pain since I pushed it in. So I made it worse. And now I'm constipated. And now I'm having, muscle tenses. When I went to my, what is it? It's surgical consult. The muscle tensors, they thought I was in pain. I was, to be honest. But the muscle tensors was so bad, I had to hold my stomach, grip it, because it would not stop. Some days are worse, some days are better, some days are hell. I hate it so much. It's so stupid! I hate this hernia. I'm so glad to get rid of it in 2 days. Ugh. Oh. And let's not forget, if I'm in a certain position on my bed, because the only position I'm happy in is sitting up on my bed or laying on my side. Even then, sometimes my gut's like, no, you can't do that. Are you kidding me? Like today, my gut and my stomach giving me all kinds of problems. All kinds of problems. It was uncomfortable. It was a little bit pain. So frustrated with myself. And I can't go to the gym. See, I've been going to the gym for about a year. A year. 2 months ago, I stopped. Because, first of all, it was the period pain. Because the period pain was horrible. And on the UDI business, and the snippet, they're going to see if I might have endometriosis. Probably not. It's probably a hormone thing. But they're going to check anyway, just to make sure. But the snippet, they literally, I would imagine, have surgical scissors or something, and they take a snippet. Anyway, this video is going to be longer than 10 minutes. And I'm going to mention to you right now, the only reason I'm talking like this and can talk like this is my situation. Because I'm almost laying in bed. If I was sitting up, I could not do this. Even talking this much is straining my abdominal muscles a little bit. And I feel it. Just 9 minutes of talking. Everything is so frustrated and I'm so angry. I want it to end. I'm so angry. I remember at least these 2 past months I broke down into tears 6 or 7 times. the majority of the time was before I pushed in the hernia, because I was so tired of being nauseous and feeling like shit. And then the other times were because I was having hard poops. It was painful. Oh, and because of the constipation, I had a hemorrhoid. I probably still do. Took suppositories for it, so hopefully it's gone. I took 8 suppositories. I was supposed to take 7, but there was an extra one left. So, hopefully that's gone. It's just loads of problems. I know I keep saying it's irritating, because it is. I just want it to be over. I wore myself out with my abdominal muscles. And I remember a week ago, my abdominal muscle was tense so bad, I had to grab the counter. And I was like bent over. Now, my surgeon said it's because of muscles being pulled down by the hernia, which is lovely. The body is such a weird, disgusting place. It's beautiful, don't get me wrong, but dear God. And last 2 weeks, I stopped myself this week. Last 2 weeks, I was looking at stuff about constipation, impact stool, hernias, and I was freaking myself out. Bad. And I got like panic attacks from it. I need to stop freaking myself out. I'm just worried, okay? And then the other day, I was looking at, I don't know how I got there. I think I was looking up mesh. Because for my hernia, they're going to cut across and put mesh over it. Your body can reject it, and it can become infected. But I also looked at there's like a 90 to 95% where none of that will happen. And there, I'm sure I'm going to have an anesthesiologist, I think that's what they're called, on Tuesday. And the surgeon or the nurse, I can't remember, they said they would talk to me about it before the surgery. I have to be there at 1, but the surgery is at 2. Let me see. Let me look at my pamphlet. 2:30. They're gonna probably put an IV in my arm, most likely. And then maybe take blood, because I looked it up, and they may take urine or blood beforehand. Everyone's different. Everyone has different hernias and stuff, so I don't know. But I know they're definitely putting an IV in my veins, so they can give me that good medicine, that good knockout medicine, and that good pain medicine. And I also looked this up. I need to stop looking up crap. But the medicine will last for like 24 hours. I'll probably be, and I need someone to take me home and bring me up there. But luckily, my dad's doing it. My dad's taking me up there, and he's taking me up there, and he's taking me back. And someone he works with, her name is Stephanie. She's an awesome person. I talked to her because I was so worried that he wouldn't be able to. She literally said, because my surgery's on Tuesday, she said, is Tuesday and Wednesday okay? I said Tuesday and Wednesday is perfect. Because the Wednesday is just to make sure that I'm okay and he can check up on me. And, after those days, I should be okay. But like I said, I'm going to be on my own. In my house alone. So, and I also looked this up. It's going to affect my mobility. Most likely because it's right on top of my belly button. It's called a pre-umbilical hernia. Umbilical hernia is like below the belly button. Mine's a pre-umbilical hernia. So, yeah. And I looked it up. You're supposed to be sore after a couple of days, which is normal, considering I'm going to have staples or whatever in me, and there's surgery, and they cut me, they cut me and do stuff to me. Good stuff, not bad stuff. It's made it seem like they're a villain or something. No. yeah. I'm really nervous. I'm really, really nervous. I mean, the surgeon seems very capable. What freaks me out is going under. Not like underground, dead, but like going under anesthesia. You know, you pass out. Not pass out, but they knock you out with the medicine, and you're just out like a light, and then you come back. I remember when I got my tonsils, like my tonsil surgery. I was a kid, and I think I remember having a little dream, but it was so small, like, because I was put under. Insignificant dream. Woke up, and obviously I was dazed, and I didn't know what was going on, to be honest. My mom and my stepdad were there, and they were there for me, and that was nice. Anyway, yeah, so I probably, and my stay there isn't going to be overnight. It's not like a heart surgery or something, a stroke. Still surgery, so I'll be there for like maybe 4 or 5, maybe 6 hours. So, I mean, that's fine. And on top of everything, I can't have takeout. Oh, fat girl needs takeout. No, I do takeout once or twice a week as a reward for dieting. I do takeout on Mondays, because on Mondays I go to the gym, and I'll do takeout afterwards. Like, oh, I'm tired. Because I'll stay there like for 4 or 5 hours. Now, before you say something, I exercise on the gym equipment for like 45 minutes to 50 minutes. And then I use the rest of my time in the pool for my back, because I have back issues. Yeah, it's kind of hard to walk sometimes. It might be due to weight, it might be due to something else. I'm not sure. I've had physical therapy for it. It's helped. And I do little physical therapy moves and stuff in the pool, so that helps. Yeah. I'm gonna stop talking. My abdomen does not feel good. It's been 17 minutes and I just keep talking, and it's making me so uncomfortable. And I'm just putting my poor stomach and abdomen and everything else through all this. Stop talking! Okay, that's it.